Good morning. This is 97.7 The Bolt, and it's time for the Humboldt County Memorial Hospital Your Care, Our Mission show. And this morning I am joined by Darla, and she's going to be talking about National Asthma Awareness Month. Right, Darla?
Yes. Emily, the month of May is National Asthma Awareness Month. So to celebrate that, we thought we would take a couple minutes to educate our community about what asthma actually is.
Mm-hmm.
Asthma is chronic. In other words, you live with it every day. Asthma makes it harder to move air in and out of your lungs. The airways are usually swollen and are extra sensitive to things that you're exposed to in the environment every day, called asthma triggers. A trigger can be like the common cold, stress, changes in the weather, dust, chemicals, smoke, or pet dander. So, what does asthma look like? Someone with asthma may hear themselves wheezing, which is a whistling sound when you breathe. They might have a frequent cough, possibly more common at night. They might be short of breath, or often we hear, I just can't get enough air into my lungs. That might also feel like their chest is tight, especially during cold weather or exercise.
Mm-hmm.
Asthma can be diagnosed at any time in a person's life. 24 million Americans have asthma, and 30% of children suffer from asthma symptoms, which cost our nation billions of dollars in healthcare costs annually. That would mean in a classroom containing 30 kids, 3 of them suffer with asthma symptoms.
Mm-hmm.
So we thought we'd celebrate today
Mm-hmm.
and put it out there that, this is the month of asthma awareness.
Yep, definitely, and it's fitting with springtime here. I'm sure that can rile up those symptoms too as well. Again, that is Darla here on 97.7 The Bolt on the Humboldt County Memorial Hospital show. We're going to take a quick break here on the Your Care, Our Mission show, and we'll be right back.
My name is Jack Dorn, and I'm a physical therapist at Humboldt County Memorial Hospital. As a certified vestibular therapist, I can assist in the diagnosis of people who are having dizziness, vertigo spells, where a person feels like the world is spinning and they cannot stand up straight or upright and can even cause nausea and vomiting at times. The most important thing with dizziness and vertigo is to diagnose it correctly. So you can treat it correctly. Once properly diagnosed, the treatment can many times be very easy and a person can have a very fast recovery from their symptoms. If you are having problems with dizziness or vertigo symptoms, especially if you get dizzy rolling in and out of bed, turning your head in the car, looking up at a shelf, turning your head when you're shopping, all you have to do is call your physician so they can contact our outpatient therapy department to schedule an appointment. And the appointments usually last about an hour. If it is a certain problem, they can only 3 to 4 treatments. A lot of times we can get rid of all the symptoms and problems that they're having.
Call Humboldt County Memorial Hospital at 332-4200 for quality care close to home.
This is 97.7 The Bolt, and we're back here with the Your Care, Our Mission show on 97.7. And it's time again to talk with Courtney, and she is a respiratory therapist, along with Darla, who we talked to just a little bit ago. And we're talking about asthma, right, Courtney?
Right. So once a patient is diagnosed with asthma, they should really create a plan. And that's kind of what our job as a respiratory therapist is to really help guide them through that journey.
Mm-hmm.
So the plan might include what medicine should they take, what advice does their physician have for them, and are the places that they spend the most time asthma friendly. So for most people, like you and me, that would be at home and at work, maybe at school.
Mm-hmm.
Is there things there that are causing their asthma to flare up?
Mm-hmm.
You should really be diligent about protecting yourself from the flu and pneumonia because you're at a greater risk for serious complications when you have asthma.
Mm-hmm.
And then lastly, find support. So whether you are the patient or the caregiver, an important part of asthma is finding the right support system. At Humboldt County Memorial Hospital, we would like to invite asthma patients and caregivers to join us for our first asthma support group. We're going to be starting that next Tuesday, May 24th at 6 p.m. We will meet for approximately 1 hour and learn some helpful information and just share some of our experiences. Sometimes you learn the most from the people that actually experience the symptoms themselves. So I know that we as healthcare professionals learn a tremendous amount from just listening to our patients every single day. So we have a group of 4 ladies that will be the facilitators for the support group. This will include Darla and myself. And we have 30 and 10 years of experience in the respiratory fields, respectively. The other 2 ladies are Val Cleveland and Terry Raymond. Not only are these 2 fantastic registered nurses out at HCMH, but they're both lifelong patients with asthma themselves. So they've been diagnosed with asthma at a very young age and have dealt with it their entire lives.
Yep.
So I think this provides a truly unique dynamic to the group. They really know the patient aspect as well as the healthcare perspective of this disease. We are very excited to see what this support group grows into in the future, and we invite anyone with asthma or who is a caregiver for someone with asthma to join us on Tuesday, May 24th at 6 p.m. out at the Humboldt Hospital. And if anybody has any questions, please give us a call. We're always there to help support you. Our number is 332-4200.
All right, awesome. Again, that is Courtney and Darla here in the Humboldt County Memorial Hospital Your Care Our Mission show on 97.7 The Bolt.